upon a time, there was a little girl who loved to eat chocolate.
Ooh, chocolate!
But she hated to brush her teeth. As she slept, she received a visit from the tooth fairy who wanted to teach her the importance of brushing her teeth before bed and what may happen if she continues these bad habits of not brushing her teeth.
I have come to teach you what can happen to your teeth if you don't brush.
What, the tooth fairy? What are you doing here? And what do you even know about brushing?
This is a nice, healthy tooth. When you consume a lot of sweets without brushing your teeth, bacteria can accumulate because it loves to eat the sugar left on your teeth. Bacteria on the teeth can then produce acid, which eats away at your tooth structure. Over time, this bacteria and acid will cause a hole in your tooth, which is also known as a cavity.
A cavity? What's a cavity?
Well, first, the tooth may appear chalky white or it may be sticky. This is hard for you and I to tell, but dental professionals can. A cavity is a hole that can grow bigger and deeper over time. So if you have a cavity, it's important to get it repaired. Now, why would your tooth develop a hole? You can blame plaque. It's a sticky substance that's made of bacteria. Remember the bacteria from the video? These mean bacteria make acids, and when plaque clings to your teeth, the acids will eat away at your enamel. See what this cavity looks like on an x-ray? We call these radiographs, and the cavity appears dark or radiolucent. Lucy, do you notice how most of these cavities are in between teeth? This is why it's very important to floss.
Flossing? I think my mom does that. Isn't that just for grown-ups?
No, it's not just for grown-ups, Lucy. Kids do it too, and you can always ask for your mom's help.
No cavities? Yes! Now it's not too late for me to start brushing my teeth.
Okay, now let's talk about interproximal caries. Interproximal caries are between two adjacent surfaces. They're typically seen on a radiograph at or just below the contact point, so that makes it hard to see clinically. If seen clinically, it could appear as a chalky white spot first, and then it progresses to roughness or stained area, followed by cavitation. So as you can see here, it's a cavity prep of an interproximal carie. And here again on the radiograph. We have class 1 incipient. These are small carious lesions only seen on the enamel. They appear as a tiny radiolucent notch in the interproximal region. They extend less than halfway through the thickness of enamel. Now, let's not get these confused with frank lesions. A frank lesion is a term we would use to describe caries that have reached the DEJ. Now, up next we have class 2 moderate caries. These extend more than halfway through the thickness of the enamel but does not involve the DEJ. They are evident only on the enamel. They appear as a radiolucent triangle with the apex of the triangle near but not involving the DEJ. Okay, now we have class 3 advanced. These affect both the enamel and the dentin. An advanced carious lesion extends through the enamel and to or through the DEJ, but does not extend through dentin more than half the distance to the pulp chamber. Now we have class 4 severe. These extend through the enamel and dentin and more than half the distance toward the pulp. They involve both the enamel and the dentin. Okay, so now we have occlusal caries. These are caries that involve the chewing surface of the posterior teeth. A thorough clinical exam is the method of choice for detection of occlusal caries. Early occlusal caries are difficult to see on dental radiographs. They cannot be seen on the radiograph until there is DEJ involvement. Here we have incipient occlusal caries. These cannot be seen on a radiograph. Thus, small incipient occlusal caries can only be detected clinically. You must use a mirror and explore. We have moderate occlusal caries. Now these caries appear as a thin radiolucent line in dentin. They're located under the enamel of an occlusal surface. These caries spread laterally, extending downward toward the pulp once the DEJ is involved. Little, if any, radiographic changes can be noted in the enamel. Severe occlusal caries. Now these are large radiolucent structures extending through the enamel and dentin beyond the DEJ. And as you can see clinically, it appears as a hole or cavity in the tooth structure. Tooth surface caries involve the cementum and dentin. Early lesions may be difficult to detect on radiographs. They occur just below the cervical region of the tooth. There is no enamel involvement. Bone loss and gingival recession must be evident. Most likely, the exposed root is saucer-shaped, and as you can see here clinically, it appears to be brownish and leather-like. Radiographically, they can be seen as a cupped-out or crater-shaped radiolucent structure, interproximally just below the CEJ. They are most commonly seen on mandibular premolars and molars. Recurrent caries, or secondary caries, are evident adjacent to a pre-existing restoration due to inadequate cavity preparations, defective margins, or incomplete removal of caries prior to placing a restoration. On a radiograph, they appear as radiolucent area just beneath a restoration. You would most often find recurrent caries in the interproximal margins of a restoration. The word rampant refers to growing or spreading. Rampant caries are advanced and severe, affecting numerous teeth in both the deciduous and permanent dentition. They exist in children with poor dietary habits, nursing bottle syndrome, or in adults with xerostomia due to various medications. On to buccal and lingual caries. The best way to find if a carie is the buccal or lingual is to examine it clinically. But as you can see here, there are buccal and lingual caries seen radiographically, superimposing on the pulp chamber. Another way to determine or locate an object on a radiograph is by using the slob method or the buccal object rule. And Andy here will explain it further.
Okay. The slob method is S, the same, L, lingual, O, opposite, and B, buccal. We're going to use the slob method to detect if it's on the lingual or the buccal surface. If I take my PID and I move it along the mesial surface and the object moves with me, it means it's on the lingual surface of the tooth. Remember? S same, L lingual. Okay, Leah, can you show them?
Right here on the lingual. See lingual.
And if I take my PID and I move it along the disc, I move it distally, it means if the object moves in the opposite direction, it means the caries is on the buccal surface of the tooth. As simple as that. It takes 2 X-rays to compare them.